Thanks, Shibayu, and hello, everybody. I'm Vijay Lamai, a climate and health scientist at the Natural Resources Defense Council, and I'll be leading the second half of today's masterclass. As a reminder, here are the four course objectives for today's class. I'm going to focus on the third and fourth objectives, where I'll discuss applications of economic valuation and some of the challenges associated with assessing the cost effectiveness of heat interventions to protect public health. In order to address the challenge of understanding the bigger picture of the health costs of climate-sensitive events generally and extreme heat specifically, our team at the Natural Resources Defense Council and the University of California, San Francisco last fall published work that uses recent U.S. case studies as examples to demonstrate potential health risks in a changing climate. Each of the case study events we analyzed occurred in the same year, and the full citation for this open access paper is on this slide. One motivation of this research is the relative lack of information about localized health costs stemming from extreme heat and other climate-sensitive exposures. Even though reports like the U.S. federal government's National Climate Assessment have highlighted hundreds of billions of dollars in economic risks related to climate impacts, policymakers and the public lack more concrete information about how much problems like extreme heat are currently costing us in terms of our health. The case study approach takes advantage of available data to combine exposure, health impact, and cost information in a consistent manner to quantify illness and mortality-related health costs. The idea is that, through this work applying valuation methods in a consistent way across case studies, we can better bound estimates of the present-day health costs during a single year, and in the process improve our estimation of future health damages related to extreme heat. This map depicts all of the climate-sensitive case studies we analyzed for health costs. The year that we selected, 2012, was at the time the hottest ever recorded in the United States. That year, more than 350 all-time high maximum temperature records were broken in locations around the country, and at least 99 million Americans experienced 10 days or more of temperatures that reached or exceeded 100 degrees Fahrenheit. We focused on extreme heat impacts in the Midwestern U.S. state of Wisconsin. In July 2012, Wisconsin residents experienced record high temperatures over a span of 1 week, causing elevated levels of heat stress, heat stroke, and heat exhaustion. Several century-old daily record maximum temperatures and record high minimum temperatures were tied or broken during this heat wave. Using heat stress health outcome data collected by Wisconsin's Environmental Public Health Tracking Program, we estimated the costs of hospital admissions, emergency room care, and heat-related deaths in the state. Specific morbidity or illness endpoints related to heat included exposure to excessive heat cramps, heat exhaustion, heat fatigue, and sunstroke. In all of these case studies, we considered human mortality costs based on the value of a statistical life (VSL) approach as implemented by the U.S. Environmental Protection Agency in its regulatory impact analyses. Each life lost was valued at $9.1 million, while a VSL range of $1 to $24.4 million was considered within sensitivity analysis. Illness costs were estimated using an incidence-based approach that encompasses medical costs from the Healthcare Cost and Utilization Project and estimates of lost wages. This slide depicts in detail the types of health costs that we included in our study. Overall, from this state-level data in Wisconsin, we estimated health costs from 27 deaths, 155 hospital admissions, and 1,620 emergency department visits in Wisconsin during the heat wave. Those health impacts resulted in significant economic damage, with an estimated $251 million associated with combined costs of premature mortality and the cost of medical care. The total estimated health-related damage from all of our case studies included in the analysis was $10 billion. But looking beyond those headline costs, it's important to consider who actually paid them. In Wisconsin, we found that Medicare and Medicaid patients were expected to shoulder about half of the illness cost burden. Overall, from all of the case studies we looked at, about 2/3 of climate-related health costs for treatment of illness fell on those same Medicare and Medicaid patients. These findings align with our understanding that low-income communities, older adults, and communities of color shoulder an inequitable cost and health burden from the climate crisis and extreme heat. Analyzing these climate-sensitive case studies, including extreme heat, for valuation required significant time and analytical resources to assemble the health incidence data in these studies, translate those data to economic damages using consistent methods, and to contextualize the results. The accumulation of evidence on health damages related to extreme heat exposures can motivate stronger investments in heat health adaptation interventions. But to scale up the application of heat health valuation, integrated tracking systems should be established to collect, synthesize, analyze, and enable easy interpretation of the underlying environmental, health, and economic data. Fundamentally, we need more integrated and timely environmental health data systems that can provide people with more timely, complete, and locally relevant information. On that note, I want to pivot now to talk about climate adaptation as it relates to valuation of heat and human health. Climate adaptation to extreme heat has the potential to partially reduce the health harms and associated economic damages from these exposures. Health protective adaptation interventions can address extreme heat threats in different ways, including early warning systems and health advisories, public cooling centers to minimize extreme heat exposures, integrated surveillance systems to monitor health problems in communities, and actions to improve infrastructure that can enable people to stay safe as temperatures continue to climb around the globe. When it comes to adaptation interventions, recent studies quantify the economic harms of extreme heat events, but the variety, scope, and complexity of health-related costs and benefits are largely ignored. When we think about climate adaptation, we need to prioritize the protection of human health. A valuation approach helps transform extreme heat risks from vague and distant threats into a relevant local issue with tangible, present-day pocketbook impacts. This approach also allows us to demonstrate the costs imposed right now by extreme heat, and by extension, the economic and health benefits of taking strong adaptation and resilience steps to avoid those exposures. We know that there are huge challenges in this space. Currently, spending on adaptation projects is nowhere near where it needs to be. It's not yet occurring at a large scale worldwide, and investments in community preparedness remain sorely out of proportion with the scale of what is needed, according to the climate models. While heat adaptation interventions are largely under-resourced, a health evaluation approach can help to translate the benefits of these projects into economic terms. Existing data on extreme heat and human health demonstrates the need for expanded heat adaptive preparedness programs and sustained attention to heat risk in communities. A valuation lens can help policymakers to understand the health and economic benefits of expanded investments in adaptation. And there are specific ways in which heat health valuation can help to make the case for stronger adaptation investments and be used to identify successes at the local level. The approach can demonstrate in tangible ways the health and economic benefits of taking steps now to avoid dangerous heat exposures for years to come. Specifically, heat health valuation analyses are useful for estimating the costs of inaction on climate change and extreme heat, and the benefits of climate change mitigation and adaptation to a wide range of stakeholders. For example, for individuals and communities, this information can help make the impacts of extreme heat and the climate crisis more local and tangible. For public health departments, they can use valuation analyses to help demonstrate local harms in economic terms and compare impacts across broader geographies. Moreover, medical professionals can rely on this information to enhance their advocacy for climate action and better understand the impacts of extreme heat on their operations. And for health systems and insurance programs, the scale and range of heat-related costs could help to inform staffing, resource allocation, and other climate adaptive planning efforts. So this slide depicts what I'm talking about in a little bit more detail and shows different types of heat interventions at different scales, working from a large scale, the country level, all the way down to the individual level. And there's examples of interventions to reduce the health problems from extreme heat exposures at each of these different scales. For example, at the individual level, in-home cooling or air conditioning is a way for some to cope with the effects of extreme heat in the places that they live. At the community level, cooling centers are sometimes established to allow people to congregate in areas that allow them to escape the worst effects of extreme heat, especially if they don't have access in their home to cooling. Moreover, communities are where buddy systems can be implemented to reduce social vulnerabilities, especially for folks who are living alone. At the built environment level within a city, modifications can be made, including cool roofs, urban greening, and other ways to provide shade for people to escape the heat. At the city and regional level, we've seen heat action plans implemented in countries around the world, allowing for a more integrated regional response to extreme heat, sometimes based on heat early warning systems. Those same systems can be applied at the country level by taking advantage of heat forecasts to allow for more long-range planning to prepare people for the adverse health problems associated with extreme heat exposures. As you can see from this diagram, there are different trade-offs to be made when working at different levels of heat interventions. As you work your way up from the individual to the neighborhood to the city to the regional or country level, there's often more agencies involved, often beyond just folks involved in public health. At the same time, we also see longer timescales involved with these heat interventions that are occurring at broader scales, although they have the potential to improve heat risks and reduce heat risks for larger populations. So there's considerations to be made in evaluating different heat interventions at different scales, and we'll talk about that in a little bit more detail later on. But regardless of the scale of the heat intervention, when it comes to extreme heat impacts on human health and the associated costs, there are key subpopulations and equity issues to consider. These issues include the disproportionate health harms related to extreme heat that are suffered by children, the elderly, women, people with pre-existing health conditions, low-income communities, immigrant workers, and other marginalized populations worldwide. With the existing evidence base, it can be difficult to broadly assess the communities where extreme heat harms are experienced over time, and what portion of those harms may be tied to occupational health risks, for example. We really need to conduct heat health surveillance and gather data on populations and neighborhoods with low capacity and few resources to adapt to extreme heat conditions. Specifically, those places can develop heat response plans, partner with local organizations and agencies serving vulnerable residents to provide heat adaptation education and assistance through cooling centers. And these places can also engage with local officials and planners on long-term community-designed solutions that mitigate the effects of extreme heat. So we know that there are adaptation interventions taking place around the world to help communities cope with the health problems associated with extreme heat. But the effectiveness of heat health adaptation projects have seldom been evaluated in a systematic way. The evaluation of adaptation interventions is an emerging science, and valuation of health benefits achieved by these programs can inform those evaluations. Here I want to point out a couple of studies that we will include in our resource page that constitute published assessments of the health effects of heat interventions. These include studies of extreme heat interventions in the United States Canada, and India. For example, in Philadelphia, the study found that the cost of running a heat wave warning system for the city was practically at the noise level compared to the economic benefits of saving 117 lives over 3 years. In Montreal, another study found evidence that the heat action plan in that city contributed to reducing mortality on hot days, and that the mortality reduction was attributable to the program greater for elderly people and people living in low education neighborhoods. I'll explain the Ahmedabad case study a little bit later on in the presentation. As I mentioned earlier, it's important to consider the equity implications of heat health interventions and local preferences in designing those interventions. The question needs to be asked, where should these interventions be implemented, and who are they actually protecting? To answer that question, planners and public health leaders can use spatially resolved heat vulnerability assessments as first steps to designing adaptation strategies. Examples of these approaches include the New York City Heat Vulnerability Mapping, which allows the city to understand where overlapping vulnerabilities impose disproportionate risks on certain communities. It's also worth asking whether certain benefit metrics should be weighted differently depending on where they are achieved. For example, should benefits achieved in high vulnerability settings carry more weight? It's also important to note that when we're talking about environmental health, it's not just the heat. We really need to consider the cumulative impacts of heat, pollution, and other stressors on vulnerable and marginalized populations. Here I want to highlight the great work of WEACT, a group based in New York City that is working on reducing community heat vulnerability and advocating for implementation of creative adaptation interventions. WEACT's overall mission is to build healthy communities by ensuring that people of color and low-income residents participate meaningfully in the creation of sound and fair environmental health protection policies. And some of the policy areas that they're scoping in New York City relate to cooling centers and dealing with the need for more social distancing during the pandemic, while improving the infrastructure, accessibility, communications, staffing, and training of individuals working in those cooling centers. Another policy area that WEACT is scoping right now in New York City is the Home Energy Assistance Program, which expands funding for low-income residents to allow for better resilience to extreme heat. WEACT is aiming for expanding the funding of the Home Energy Assistance Program and also the eligibility of that program. Moreover, they're working to improve public education and information about the program to ensure that enrollment is robust and that it's a simple enrollment process. WEACT is working to expand beyond just air conditioning to include assistance for folks to pay their utility bills and to deliver incentives for utilizing alternative energy sources. Collectively, WEACT is leading the way to improving the equity of heat health interventions. When considering any of these intervention actions, it's important also to consider the unintended consequences and other complications that play into evaluating impacts of these interventions. For example, it's important to consider that these interventions take place across different scales, and as a result, comparing their effects is often difficult. Moreover, there are sometimes unintended environmental consequences to heat health interventions like air conditioning. A study published in 2018 found that when people use air conditioning to cope with extreme heat, they can actually worsen ambient air pollution because of the underlying sources of electricity to power that air conditioning. Moreover, it's important to consider impacts beyond just human health, including longer-term effects on property values and gentrification that are experienced downstream from these adaptation interventions, especially changes to infrastructure. And lastly, it's important to consider the time horizon for measuring the efficacy of these heat health interventions. It's important to think about the operation and maintenance needs of some of these interventions over a long time scale. For example, urban greening is oftentimes cited as a promising solution to expand shade and reduce the urban heat island effect. But these operation and maintenance needs of urban greening programs are not always taken into consideration during planning. Now I want to highlight Ahmedabad, India, as an example of a city implementing multiple heat intervention strategies all at once. India faces major risks from climate change-driven extreme heat. South Asia has documented some of the warmest temperatures ever recorded on the planet, and these more frequent and intense heat episodes aren't just an inconvenience, they can be deadly. The number of high temperature days in India has increased over the past 50 years, and especially since the 1990s, in highly populated cities like Mumbai, Delhi, Chennai, and Jaipur. These cities experience even higher temperatures than their surroundings due to the urban heat island effect. In 2010, the city of Ahmedabad, in the western Indian state of Gujarat, experienced about 1,300 excess deaths during a heat wave. And it was that experience that really motivated the city to become South Asia's first city implementing a heat action plan to better prepare and respond to the health risks of extreme heat. Ahmedabad launched its Heat Action Plan, or HAP, in 2013, and it really encompasses 4 key strategies. First, an early warning system and an interagency emergency response plan that allow the city to better understand heat risks and communicate those risks to citizens. Secondly, a broad public awareness and community outreach plan that allows the city to communicate the risks of heat waves in health terms and implement local practices to prevent heat-related deaths and illnesses. The city undertook expanded capacity building of medical professionals on the front lines of heat waves by focusing training on primary medical care officers and other paramedical staff and community health staff workers. Lastly, the city has been working to reduce heat exposure and promote adaptive measures, including cool roofs and urban greening. Collectively, these 4 pillars constitute a multi-pronged strategy to improving resilience to extreme heat across the city. This slide explains Ahmedabad's Heat Early Warning System, which was launched along with the overall Heat Action Plan and is built on national forecasts from the India Meteorological Department tailored to cities around the country. This Heat Early Warning System alerts residents of predicted heat wave episodes, and it activates the municipal government agencies to respond in advance of extreme heat events. So this table displays different alert categories based on the day's temperature forecast. So you can see that each alert category is associated with a different alert type or name. And for example, extreme heat alert dates constitute the highest risk and activate all of the city's efforts to improve resilience at the local level. This slide shows just how key community engagement is in Ahmedabad's Heat Action Plan. It's really a key strategy within the plan, and depicted here are 2 pictures demonstrating community engagement. First is a local parade highlighting the human health risks of extreme heat. On the right is a pilot cool roof implementation program launched in 2017. Cool roofs are really an important component of Ahmedabad's Heat Action Plan. These roofs reflect incoming sunlight and absorb less heat, reducing the urban heat island effect. And depending on the setting, cool roofs can actually keep indoor temperatures lower by a couple of degrees Celsius, as compared to traditional roofs. They are cost-effective solutions that help to protect vulnerable groups in slum communities. Cities, states, and the national government in India are taking steps to protect communities and save energy costs through these cool roof programs. Ahmedabad has started a Cool Roofs program for over 15,000 buildings as part of its heat action plan, focusing on slum households and city-owned buildings. Building on the initial pilot program from 2017, another Indian city, Hyderabad, now has a draft statewide policy as part of its building efficiency program to support cool roof implementation. Nationally, India is working towards sustainable cooling for all with the country's India Cooling Action Plan, which includes promotion of passive cooling techniques such as cool roofs and energy efficiency programs for buildings, air conditioners, and fans. In this way, the Heat Action Plan in Ahmedabad has really motivated and sparked action to improve resilience to extreme heat across the country. And the effectiveness of the bundled adaptation interventions of multiple strategies encompassed within the Ahmedabad Heat Action Plan has actually been evaluated. In 2018, Hess et al. Compared the all-cause mortality rates in the city for several years, encompassing both pre- and post-Heat Action Plan implementation. That study found that Ahmedabad has avoided an estimated 1,100 heat-related deaths each year since the 2013 launch of the city's plan. And more than half of those deaths, 600 of the 1,100, were avoided on the hottest days, when temperatures soared above 45 degrees Celsius. From this study, it's clear that it's important to consider health surveillance as part of project planning, implementation, and evaluation. When we think about health metrics, we can arrive at a more robust estimation of the benefits in both health and economic terms of multiple heat intervention resilience strategies. It's helpful to consider the context here for Ahmedabad's plan in understanding the general budget and resources involved in implementing it. We understand that setting up the Ahmedabad Heat Action Plan cost about $60,000 in US dollars each year. And other factors can prove even more challenging to establish dollar metrics around in continuing implementation of the heat action plans, including the need for robust political will among city leadership to support strong engagement, and the challenges of introducing a new ongoing program to city health officials who are already handling other major work responsibilities. But it's all of these factors that really need to be considered in assessing the cost effectiveness of a plan. Nevertheless, the striking results from this study demonstrate that heat interventions can really achieve huge benefits for public health, especially when they're bundled together. Fundamentally, information about the substantial costs of extreme heat on human health can help to convince people, including policymakers, of the enormous benefits of actions to improve community resilience to soaring temperatures. But at present, it's difficult to characterize the costs of health harms linked to extreme heat. New, locally relevant information made available through this method and improved environmental health tracking systems can highlight the need for a more coherent and integrated response to extreme heat impacts on human health. By translating extreme heat exposures into tangible impacts on human health and healthcare costs, the problem becomes more relevant and urgent, and the urgency of helping people to enjoy the benefits of avoiding those harms and costs becomes more central. I want to thank you all for your attendance at this masterclass and invite you to submit questions and comments either now or later on. My contact information is included on this slide, and we will post highlighted resources on the course page along with answers to your frequently asked questions soon. Thanks a lot.